Hello and welcome to today's seminar in the Smart Mobility Connection series. My name is Hajar Shahab and I am the Traffic 21 Women in Transportation Fellow and a second year MS Policy and Data Analytics student at Carnegie Mellon. The Smart Mobility Connection series is sponsored by the Traffic 21 Institute and the Mobility 21 University Transportation Center as an opportunity for faculty to show their current transportation projects. It is also an opportunity for students, fellow faculty, deployment partners, and the broader community to engage and network with researchers, highlight opportunities for involvement, and foster future interdisciplinary collaboration. Please note this session is being recorded and all participants' microphones are muted. To ask a question, please send a message through the chat box. You do not need to wait until the end of the presentation to send your questions. Now I would like to introduce today's speaker. Erick Guerra, PhD, is Associate Professor in City and Regional Planning at the University of Pennsylvania, where he teaches courses in transportation planning and quantitative planning methods. His research focuses on relationships between land use, transportation systems, and travel behavior with an emphasis on rapidly motorizing cities, public health outcomes, and transportation technologies. He has published recent articles on land use and transportation in Mexico and Indonesia, public transport policy, land use and traffic safety, and contemporary planning for self-driving vehicles. Please help me welcome Erick Guerra as he tells us about his University Transportation Center project, What the Heck is a Choice Rider, a theoretical framework and empirical model.
So good afternoon again. What the Heck is a choice rider, a theoretical framework and empirical analysis? The term choice rider first enters the English lexicon in the 1960s and peaks in the mid 1970s. It generally is used in kind of public transportation planning reports. And here's an example from the 1960s from your local area. So Pittsburgh area transportation study. It's almost exclusively used in opposition to another type of transit user, captive rider, necessity rider, or dependent rider. In the 70s, the term captive rider was particularly popular, although that's largely been supplanted by the term dependent rider, which is on the bottom, which is the more popular contemporary term. And the term comes into use largely during the public takeover of privately owned and operated transit systems, as well as city-owned and operated transit systems. It happens around the same time as the Urban Mass Transportation Act of 1964, and later the creation of the Federal Transit Administration. And it's used as a way to characterize transit markets and government reports about transit, textbooks, and also some journal articles. So what actually is a choice rider? Here's just a list of some of the associated keywords from these early planning reports. There are a lot of quite circular definitions. An example being a choice rider is someone who can choose between transit and a car. But these keywords kind of show what some of the beliefs about what a choice rider are. They tend to be car-owning drivers, white-collar workers, white, living in wealthy neighborhoods, more likely to be suburban, taking rail for longer trips to a central business district, and generally focused on high-quality trips. By contrast, captive riders are more likely to be carless, non-drivers, more likely to be racial minorities, poorer households, taking short trips by bus in central cities. And this has some broader uses and planning implications. So one of the main focuses of these reports and the use of these terms is to argue that transit agencies must do more to attract choice riders for a few different reasons. One is dependent riders will use transit no matter what, so there's no need to focus on them. And since justifications for transit investments relate to second best pricing, whereby the economic justification for public takeover and subsidy relates to attracting people out of cars. Transit should be about attracting people out of cars. And then the third reason is really you can't grow your transit mode share from dependent riders, because if you invest, you're not going to get more riders. And the end result is fundamentally an argument that transit investment should focus on high capacity transit to support white, wealthy, suburban, car owning workers with downtown jobs. Here's just an example of some ways that this is used in the early literature. So a portion of this market will always exist, the captive rider as previously described. Another portion will exist only as long as transit service is attractive, the choice rider. The captive rider has no choice but to wait regardless of the headway between buses or trains, but the choice rider can get back in his car and drive. And then the last quote is a little bit more about a political economy, but also paints a fairly negative picture of the captive rider. And in the nature of things, captive riders are not a particularly potent political force, which is an argument for not, again, focusing on transit investments into neighborhoods with the associated keywords from before. This has led to probably some poor transit policy and arguably racist public policy. This is a particularly famous example from Los Angeles. The MTA started investing in commuter rail, light rail, and heavy rail in the 1980s and 90s. And at the same time, there was a big deterioration in bus services. Bus services were primarily taken by people of color. About 85% of the passengers were people of color. By contrast, the existing rail services were about 28%. And you can also see that the subsidies were much higher per passenger on light rail, subway, and commuter rail than on the bus. And there was a famous court battle and an injunction, and is just one of many examples of how this creation of this idea of a choice and dependent rider contributes to some of these public policies. So the main study motivation, after 50 years of use, the term choice rider really doesn't have a strong theoretical or empirical definition. In terms of public policy, a poorly conceptualized and unmeasured term has encouraged investments in a way that may not produce the best public policy. So I'm looking at the question of what is a choice rider, and I'm working to develop a theoretically valid and empirically based model of choice ridership, apply it to real world data, and see who actually is a choice rider. The academic literature talks quite a bit about choice and dependent riders, although in a slightly different way from the professional literature and the gray literature. That said, often the academic literature does use similar terms. So here's an example from a paper on the LA Bus Riders Union. So the dilemma of serving either choice or captive riders gets even more complicated. To lure people out of their cars requires highly attractive service, and attractive service means higher costs for cash-strapped agencies, especially for distant, low-density suburbs. Keeping transit-dependent customers, by contrast, does not require good service because these riders have no other choice. It's often used in the academic literature as a way of defining transit markets, and I just give a few examples. So trying to characterize who the users are and potentially what they're more likely to respond to in terms of changes in service. It's also, the terms are frequently used in papers demonstrating unfairness in transit systems or discussing unfairness in transit systems. One example from Brian Taylor and Erick Morris in 2015, they find that only a small share of agency representatives, they survey a bunch, really focus on serving transit-dependent populations as an important public policy goal. And that's part of why they prioritize commuter rail-oriented investments. There's also quite a bit of evidence of choice throughout the literature. So in kind of this one almost makes you laugh, a paper from 2000, after defining someone as transit-dependent, finds that they only use transit for 16% of trips. And transit dependency is defined by auto availability, age, and license status. And even today, if you only look across the US at low income households without cars, using the National Household Travel Survey, more trips are taken by car than by transit. And as Jen Giuliano in a 2005 paper observes, most poor US households are more car dependent than they are transit dependent. And these findings really correspond with a broad literature on the car use of low income and carless households. So talking about my research design, I think a really simple conceptual framework to defining choice ridership. I define a choice rider as someone who has close to a 50% chance of taking transit or a car. So that's in the definition of choice is kind of being somewhat on the fence. So a choice, someone kind of closer to this 0.5 probability, small changes in car service or the price of driving or the quality of transit is more likely to lead that person to switch modes than someone who's kind of very close to a probability of 1 of driving or very close to a probability of 1 of taking transit. To estimate the model, I use a random utility framework. Random utility models have a long history in transportation mode choice. Some of the early papers are around choosing transit over a car from the Bay Area. I use this framework, a binomial logit model, and I'm basically predicting the probability of choosing transit over car based on socioeconomic factors that are associated that have been used to describe choice-independent riders, trip-related geographic and service-related features of the different trips. In terms of case context, my study draws on data from the Philadelphia region. It's an area with relatively high transit use, sometimes described the kind of poorest big city in America. And there's a substantial urban bus network that is kind of characteristic of how the literature might describe transit dependency in parts of Philadelphia and Camden. But there's also substantial commuter rail service into wealthy areas. And the western suburbs are sometimes referred to, the wealthy western suburbs, as the main line, kind of referring back to the original regional rail service provision to that area. So very characteristic of both choice riders as they're defined and also dependent riders. In terms of model specification, I've got about 21,000 transit and car trips reported on the Regional Household Travel Survey, predictor variables, age, gender, race, household income, educational attainment, occupation, vehicles and household, presence of children. I've got information on the origins and destination types, travel time and cost, and then information on kind of where a resident lives, what the built environment is like around their origins and destinations, price, and quality of transit service. So in terms of just giving a summary of the outputs of the model, it's a relatively strong model fit with intuitive results and parameter estimates. There's a pseudo McFadden-Ard squared of 0.54, which means as a mode share individual level predictive model, it's very strong at predicting. And there should be a handout, a PDF available to you. There are 2 tables in it. And the first one is just the full output of the models for anyone who's interested in looking through that as I continue the talk. And I'm just going to summarize a few of the important takeaways. So unsurprisingly, and again, this gets into having intuitive results, residents from the poorest households and households without cars are more likely to use transit than those from other households. Find that women are less likely to use transit when controlling for other predictor variables, as are those from households with young children. In terms of environmental and trip characteristics, residents are much more likely to use transit on trips that are connected by rail stations and in areas and times of day with higher bus frequency. Higher parking meter prices, a greater mix of land uses, and closer proximity to downtown Philadelphia are all also statistically associated with a higher probability of choosing transit. And then just kind of a final, the average person's willingness to pay is about $20 to save an hour of travel time, which is quite reasonable estimate for the region. These results, however, don't really tell us much about who is a choice rider. This is just to summarize that the model makes sense. It's giving intuitive estimates. We know that these types of factors are associated with a higher probability of using transit. So to really focus on choice riders, I think about who are these people and what are these trips where someone is close to this 50% probability of choosing to take transit. So these are the people up here with a very high probability, nearly 1, of choosing transit. And here are what we might define as auto-dependents, people with a very low probability of taking transit. And table 2 in the handout summarizes some of the socioeconomic and trip characteristics of people in three categories. One is this choice ridership category. Then there's also, you could think of as auto dependency, so trips where the probability of choosing transit was less than 1%, and then trips with a probability above 99%. So what is a choice rider? The first takeaway is that many of the socioeconomic factors associated with definitions of transit dependency are much more common for choice riders than for the general population. Just as an example, choice riders are substantially more likely to be lower income. The blue histogram is the histogram of income group. This is under 25,000, and then there are brackets all the way up to 200,000 plus. You can see it follows a bit of a U pattern, which is something that we see quite commonly with transit use. And this is the income distribution for all trips. And you can see that choice riders are much more likely to be lower income. They're also more likely to be non-white. They're also much more likely to be carless, so to not have a car or to have one car instead of two or more vehicles. The second main takeaway is that transit service quality is critical to choice ridership. The travel time difference between transit and cars, so if you think about on a given trip, how long is it going to take me to drive versus take transit? It's only 4.5 minutes for choice riders, so taking transit is not much slower. In many examples, it's actually faster. And this compares to 51 minutes for the auto dependent, so people with less than a 1% probability of taking transit, and 34 minutes for the total sample. And when you kind of look at this related to price, you need to have like a value of time of almost just like $2 an hour to choose transit for most trips across the sample. So quite low. And then for the auto dependents, it's less than $1 per hour. Choice transit riders have rail stations near the origins and destinations of their trips for 2/3 of their trips, and nearby buses arrive every 6 minutes on average, so really good transit service. Based on a number of these factors in concert, you can see that choice riders in blue, this is just a distribution of where choice riders live, kind of distance from City Hall in Philadelphia, and a much higher share live close to downtown, where there's much better bus and rail service. And by contrast, the rest of the entire metropolitan sample looks really different, with more people living further away and not as strong of a concentration towards the center. The third takeaway is that transit dependents, at least as I kind of am able to define them in this study based on probability, a very high probability of using transit by some of these socioeconomic factors that the literature associates with dependency. By that definition, transit dependency is quite rare. I just want to add a quick caveat. That doesn't mean that there aren't people who depend on transit for all or part of their daily commutes. It's just not varying systematically in the way that the literature describes it. Just 31 trips, 0.1% of the sample had a greater than 99% chance of being by transit. And if you expand that to 95%, the results look really similar, only it expands the N by quite a bit. These trips have the highest quality transit options in the data set. And just to kind of characterize that in two ways related to the socioeconomic factors as well, wealthy white residents with multiple cars also have a very high likelihood of taking transit when buses arrive every 3 minutes. High capacity rail connects both trip ends, parking is expensive, and transit is both faster and less expensive than driving. Put another way, when buses arrive infrequently, there's no high capacity rail. Most of the sample moves by car, regardless of race, income, gender, education, and even the number of household vehicles. The last takeaway is there's actually quite a bit of diversity in the types of choice riders. There are low-income bus users and high-income commuter rail users. There's also a mix of age, race, ethnic, and socioeconomic profiles, educational profiles as well. Some have multiple cars, others have none. Some work in downtown office jobs and others have retail jobs outside of Philadelphia. The strongest commonality across these groups of choice riders is that transit is generally competitive with the car in terms of cost, travel time, and convenience. So I'm just going to wrap up with a summary of the talk, a summary of the findings, and then a few takeaways for public policy. So in summary, in this project, I developed a theoretical model of choice ridership, and I applied it to data from a travel survey in Philadelphia. Philadelphia is a great place to study choice and transit dependency, since there's substantial bus service in low-income urban neighborhoods, and also high-capacity commuter rail service into wealthy suburban neighborhoods. The model fits the data quite well and provides strong and intuitive predictions of choosing transit or a private car. The model produces individual parameter estimates that are consistent with the literature, and also produces reasonable willingness to pay estimates for travel time savings. Key findings, many of the attributes assumed to be associated with transit dependence, such as lack of a car, being low income, from a racial or ethnic minority. These features are much more prevalent among choice riders than the general metropolitan population. I also find that, at least as defined in this paper, transit dependency is quite rare. Taken to the absurd, you can't have transit dependency because if there's no service, no one can depend on transit. Like I said, that's a little bit reducing it to be absurd, but as quality gets worse and worse, people are less and less likely to take transit, and no one is really depending on it in a situation where the quality is too poor. Residents generally only choose transit when service is high quality, and transit is cost and time competitive with the car for a given trip. And I didn't break down this data too much, but if you look and summarize the data by those without cars, people without cars frequently borrow one or get a ride from family, friends, or colleagues, and particularly when transit is not a reasonable option. And this is consistent with the literature on carless households. In terms of takeaways for policymakers, popular professional and academic characterizations of choice riders are almost certainly inaccurate. So kind of what we think of, how we define choice riders is problematic. A reconception based on a solid theoretical and empirical grounding. So basically the idea that someone who chooses to take transit, a choice rider, is someone who is close to a 50% probability of taking transit. If we focus on that, we're going to be more likely to invest in services that go into poorer minority neighborhoods and more central urban parts of cities. And by extension, this kind of debate that sometimes people characterize of using transit either to reduce automobile use or to increase accessibility for low-income transit users is largely misplaced. They actually go quite well together. Making transit investments into places with high concentrations of low-income transit users is likely to draw people out of cars. A few kind of more sobering notes, I think to end on. Even in a transit-friendly region like Philadelphia, most residents, or many residents, live and travel in areas where transit just isn't a reasonable option. So across the sample, taking a trip by car saves an average of 34 minutes per trip. That's quite a bit of time. For the 51% of the sample, and if you weight that by the sample weighting, it's probably more like 45%. But for the 51% of the sample with a lower than 1% chance of taking transit, the difference is nearly an hour. So you're losing about an hour by taking transit instead of driving. Attracting auto dependence to transit through either transit investments or land use policy is therefore almost certainly prohibitively expensive and time consuming. So getting that 60 minutes down to the 5 minutes of a choice rider would take a lot of time, effort, and money. And by extension, I think unless new technologies or business models can start to make transit competitive with cars for these types of trips with like an hour difference, focusing investments into urban areas with high concentrations of high probability transit riders will not only do the most to improve service for existing users, but it will almost certainly do the most to draw riders out of cars and to produce associated environmental, social, and economic benefits. So thank you so much for your time. I just want to acknowledge again that this research was funded by Mobility 21. I also want to thank Matthew Gates of the Delaware Valley Regional Planning Commission for providing data, giving a ton of support on estimating travel time and travel costs from the Regional Household Travel Survey. Grant Engel, Chris Puhalski, and Patricia Ellis Dinatalik and Andrew Simpson also provided quite a bit of data support and feedback on the takeaways for public policymakers. And then lastly, I just want to thank two fabulous research assistants, Han Chiao and Andrew Wong, for helping process the data, estimate the models, and generate the figures. So thank you so much for your time. I look forward to your questions and your comments.
Thanks, Eric. I have a few questions.
Terrific.
First one, wouldn't incorporating TOD into land use policies on the front end help attract more riders on the back end?
Wouldn't introducing more TO. So I feel like I need to maybe, I'm a little confused by the question, so maybe let me kind of try and unpack it in a few different ways. So so thinking about TOD policy, I guess I'll kind of try and frame it as public policy to encourage growth around transit stations. Does that sound roughly what you're going for? I think that doing that in areas with higher transit use that's already there will do more to generate transit ridership than it will in areas where there's really kind of lower probability transit ridership, if that makes sense. And similarly, the markets will respond better. So, you know, unless you're putting in a whole bunch of subsidy, TOD policy is essentially about deregulating land use. So deregulating land use potentially around transit stations. That's only going to have an effect on actual land uses if people want to live near it, and if developers go and build new housing or new offices. So if there's not a demand in an area because just transit is not that reliable, you could put in as, you know, you could deregulate as much as you want. Not much is going to happen. By contrast, in areas where transit works quite well, so in Philadelphia, for example, there's a lot of opportunity to promote TOD policies that would improve, that would allow more people to live closer to the areas that have better transit service and would almost certainly increase ridership. So I'm not sure I precisely answered your question, but hopefully I touched on what you're trying to say.
Yeah, her point was that one of the last bullet points said land use policies are an expensive way to attract riders.
Yeah, for sure. In those types of areas. So land use policy could be a very inexpensive way in certain areas. So as an example, you know, if it's strictly deregulation, that's not expensive at all. But thinking about how do you use land use policy to shape travel behavior in a place where, on average, you know, a car is going to save you 60 minutes over transit. I think that's a much more expensive and time-consuming proposition, and I don't think it's realistic.
Okay, thank you. Another one. I'm interested to know if you have any knowledge of the ridership data comparing ridership pre-COVID and during COVID, and how that might provide insight into choice ridership.
I do, and it's something I'm really quite interested in. So one of the big challenges with looking at that data is SEPTA's APC data is not fabulous. So it's sample data, and it can actually be quite difficult to get estimates, reliable estimates of ridership pre and post COVID, or pre and post the city lockdown. And actually SEPTA generally kind of reports its main ridership figures based on fares. And there were weeks when they weren't collecting fares. So the most reliable mechanisms for estimating riders aren't really there. So we've done some estimates using APC data and extrapolating them using GTFS and other kind of bus frequency data, and trying to look at kind of which parts of urban areas were more robust to kind of losses in transit ridership. And I suspect we'll see some similarities kind of to what I found here, in that probably the areas that continue to have relatively high ridership are the areas where you have high concentrations of these types of, what I characterize as choice riders. That said, I would not be surprised if we start seeing some people kind of being more likely to abandon transit, even though it's time and cost competitive, and they may be more kind of able to do so if they have access to other types of modes. So it's a really interesting question. Unfortunately, there's almost no individual level pre and post data, but there's some aggregate data, and I think that can be associated with some other types of aggregate data to provide some insight into that question. And I almost want to think of it even less in terms of choice ridership and more in terms of, service criticality. So what are the most important parts of the system? And you could think of that as dependency if you want, but I really dislike the term dependency just because it is associated with this, hey, people don't really care about their service quality, so we can safely ignore it. I just don't think that's the case. And, anytime you reduce the quality of service, people stop using transit as much, regardless of their income, regardless of their access to private cars.
Okay. Wouldn't making transit more attractive to choice riders also make it, in general, better for dependent riders?
I don't actually think that there's really such a thing as dependent riders, or it's a very small part of the population. And I would agree. I think probably what people characterize as transit dependents are actually much more likely to be choice riders. So I think that it's roughly doing the same thing. Like, I actually think at least the way the literature characterizes transit dependents are actually empirically choice riders. So I don't see this disconnect.
Okay. How does the study account for reverse commuting and for pockets of choice riders that might live near suburban areas that are relatively more transit rich, such as Eastern Delaware County and Norristown?
So there are two main ways that the kind of modeling process is dealing with it. The main way is just price and time. So how much does it cost and how long does it take? And those are going to be more attractive in areas with those better types of transit service, relative to areas that have worse transit service. And the second is just having a focus on whether there's access to high capacity transit at the origin and destination. So I do think that it matters. One thing that I would add to that, though, is that those kind of areas, they represent a really small fraction of total transit use. So there certainly are, and I'm not arguing that regional rail is not important. I'm not arguing that reverse commuting is not important. I am, however, arguing that the kind of most of the choice riders are living in more urban environments and in situations that are more often characterized as transit dependent areas, which I think is largely inaccurate.
Okay. Does the form of payment method also play a role in transit mode choice? Is it as important as the payment itself? For example, in some cities where their transit card is used and other cities don't.
Yeah, I don't have any way to kind of provide information on that from this study. I think kind of theoretically, if you were purchasing like a monthly pass, that's probably going to influence your probability of taking transit on more trips, since you kind of pay this upfront cost and the marginal cost is zero. That said, I think the literature on transit fare payments, they don't show it as being this kind of major important determinant of mode choice. And where it does matter, it probably matters at the margin, and it doesn't, it really doesn't make much of a difference when you compare it to factors like travel time, travel costs, service quality, service reliability, which are really the big factors that influence choice.
Okay, how does the choice ridership model account for those who use a car for only a portion of their commutes, such as driving to a suburban rail station, then taking a train downtown?
For simplification, we just treated them as transit users. So that's a great question. That multimodality certainly exists, and accessing high capacity transit stations is a particularly important part of certain types of trips, but it's a relatively small share of total trips. But yeah, that exists, and in part for convenience, that's being treated, or we're treating that as a transit trip, because it's mostly transit.
Okay, how does the quality of first and last mile services affect choice transit ridership?
So that's difficult to tell from the household travel survey data. I think it matters quite a bit. And in terms of thinking about what the model says, those attributes are almost certainly absorbed in the measures of bus service frequency, the measures of proximity to rail, and the measures of travel time and travel cost. So it's not explicitly factored into the model, but it is going to show up in those relationships. I know that, and SEPTA and Philadelphia, I would say in particular, have this kind of, they've had this long planning emphasis on a one-seat ride, like this obsession with a one-seat ride. But I think that's probably less important than most people think, at least around here. It's really, at the end of the day, is the service reasonable? If transfers are good, no one minds transferring, or not no one minds, but the transfer costs are very low in a system that's well integrated. And in a system that's poorly integrated with infrequent service, like the transfer penalties are high. Like, as an example, I don't know how many of you have taken the SEPTA to New Jersey Transit to go to New York. I think people don't do that as much anymore because it's there are more companies providing the service by bus. But when I was a student in the region, that was an easy way to save money instead of taking the Amtrak. And in those times, the buses tended to be a bit more expensive as well. And if you miss that transfer, you're waiting an hour for the next train to come, and so that's a really expensive transfer. But if you're thinking about transferring from the Market Frankfurt line to the Broad Street line, so you've got this kind of really high frequency service, the transfer penalty is really low. So I guess I think transfers matter most in the way that they influence time, and then convenience, cost, service quality.
Okay, does perception of transit play into the decision to ride transit by choice users? Safety, who rides, cleanliness, etc.
I think almost certainly, but I can't answer that with the data I have. There's no information on preference other than kind of the way that it might be associated with some of the socioeconomic control variables. And so that would all just be captured in the error term, because there is no, we don't have information about preferences. But yeah, there are some people who are gonna take transit when it doesn't look like it makes sense to other people on cost and convenience because they really prefer transit, or their other modes are difficult for reasons that we might not observe in the data, or that you might not understand just looking from their travel patterns. But then if you sit down and talk with them, they'll explain it to you. And similarly, you see people in the data, you're like, why the hell did this person take a car? I mean, they would have saved so much time and money if they took transit. And if you sat down and talked to them, it may just be that it's associated with some other trip later in the day, like they need their car for something. So that wouldn't actually be a preference, but it's something we didn't observe in the data. But it might also just be they hate the bus, or they hate the train, or I have a friend that I went to. I did my PhD program at Berkeley, and I had a friend who lived below me in a building, and he worked in downtown San Francisco. And where we were in Oakland, it was super convenient to take the BART there. He never took the BART because going underneath the bay, he had sensitive ears, and it produced this really loud noise that made it really unpleasant for him. So even though it looked like it made a ton of sense on travel time and travel cost, it didn't. So he used casual carpool. And that's something that you're almost never going to observe in the data. And it's just, gets captured in the error term. But I would argue, I guess, thinking about how that impacts this study, I don't think it matters that much, because I think for me, the headline finding is really that the things that we can measure and that we have said in the past are associated with transit dependency aren't. And they're much more likely to be associated with having a kind of 50-50 probability of using transit or a car.
Okay, do you think these results will be able to be replicated in other metro geographic areas?
Yeah, I think so. I mean, I think one issue is that not all places are going to have the same kind of diversity of services and the same diversity in the population. So, if you go some parts of the country, you're going to go and look, and there's going to be very few trips where transit is time and cost competitive. So in that respect, it'll look really different. And also, if you go to some cities, the people living there might be much more homogenous in terms of income, race, ethnicity, access to cars. So, there might not be enough variance to look at it, but I suspect it would hold in most cities that have a variety of services. And within the U.S., I mean, I think if you go outside the U.S., you're going to start to see some things that are different, and then some things that are really similar. So one of the things that's going to be really different, if you looked at most Latin American cities, for example, even when you get into the suburbs in most Latin American cities, transit is going to be much more time and cost competitive with a car, just because transit service is much higher quality and more ubiquitous. So that I think that's a big difference.
Okay, if you were going to plan a phase 2 of this project, what would you want to do?
Oh, that's an interesting question. I think at this point, I almost feel like a qualitative element to the study. So kind of interviewing people about choosing transit, and interviewing and focus groups about these conceptions of dependency, conceptions of choice, I think would be interesting, and push the research another step forward, and just kind of get more of these stories that illustrate this idea that even people who we might think, oh yeah, this person has to use transit, for them to say why they don't, or why they do, and how they're kind of weighing the pros and cons of the different choice, I think would add insight into the main findings.
Okay, did you determine that choice-independent riders define high-quality transit in the same way? Is the premier desirable characteristic travel time competitive with the car trip, or do some choice riders also strongly need amenities, like more comfortable buses, Wi-Fi, more personal space, etc.? Or are they amenity agnostic?
That's not answerable with the data. So that I think is, I don't think anyone's amenity agnostic. I think there's a question of whether these amenities can attract many people. And then maybe to reframe your question, I think the way that the existing literature frames choice and dependent riders, they would say, oh, we need these amenities to attract the low probability riders who are, white, and they're, working downtown jobs, et cetera, and maybe live in the suburbs. And I would really challenge that. And I would say, actually, you need the amenities in places that are more reliant on, say, urban bus service, because that's where you actually have a higher probability of attracting people by amenity. And that's one of my fundamental problems with this whole concept of choice and dependent riders is it's basically an excuse to just kind of ignore your, one of your most important customer bases, and just say, oh, they don't need the amenities. Somehow we need these amenities to attract people who are dissimilar from the people who are using transit in these circumstances. And I think that's incorrect. And I think we really want to focus those amenities in specific types of places in order for them to kind of have the most bang for the buck, to provide the best outcomes. And those aren't, the places that have all those keywords that I showed at the beginning that are, the stereotypical choice rider. And instead, much more so the right column of the things that we associate through the literature with transit dependency.
Okay, do any of the Philadelphia area bus routes use the bus rapid transit model? And if so, has ridership increased on bus rapid transit routes versus traditional local bus routes that bus rapid transit models replace?
So I guess it depends on who you ask. So if you ask someone from ITDP with their bus rapid transit manual, they would say we don't have any bus rapid transit. We do have a few lines that are kind of more similar to, say, the select bus lines in New York that have priority, that you switch them from having like 20 stops along a certain line to having maybe 5 stops, and then also running some local services. And so there's a bus line on Roosevelt Boulevard that was recently redone in this way, and ridership went up. And I think that does reflect the improvement to the service. So the service got better, it got faster, and it got, it's working now so that more people can get where they're going in a speedier way, and ridership went up. That's consistent with what we know about transit in general.
Okay, should policy changes have to do with converting drivers to bus riders on a per ride basis or on an aggregate level?
I don't understand the question. I apologize.
Okay, I have another one.
Could you elaborate?
I will get clarification from him, and I'll give you another question. We'll come back to that one. What advice would you give your students interested in transportation or transportation research?
That's a guy. I feel like I'm giving out too much advice every day. As I'm teaching, trying to think about what are some of the main. I would say, focus on what you're passionate about. I think, I guess I'll give a piece of advice that I gave my students at the last class that I taught, and we were talking a lot about policy in the U.S., and we were talking a lot about equity. And I think, as is commonly the case for transportation planners, and I would say this is the case for me, is I very much believe in policies that encourage and support biking, walking, and transit. At the same time, so one of the things that I really asked them to think about is this fact that transit service is really poor in a lot of areas, and most low-income households are really reliant on cars, and losing access to a car is extremely problematic in most of the built environments of this country. It's associated with like bad economic outcomes, bad health outcomes, bad, it's a really negative external shock, and you can look at the data and see how it affects people when their car breaks down. So I was kind of, one of the things that I asked them to think about, encourage them to think about is, if they really care about social justice, they need to think about providing, at least in the short term, encouraging access to cars for people who need them and can't afford them, because so much of the country is just not suited to transit.
Okay, I got clarification on the last question. So what they're asking is, should we try to make drivers use transit consistently or replace a few specific rides?
Oh, I don't know. That's an interesting question. I think the two are almost certainly strongly related. So if you're if you're doing improvements that encourage someone to take a few more rides by transit, you're probably also encouraging someone else to switch entirely to transit. You're going to have a distribution of responses. On both ends, you're going to have people who don't respond at all. You're going to have people who don't respond and continue their driving routine, and you're going to have people who don't respond at all and continue their transit routine. But thinking about those who are most likely to change, it's interesting because some of them probably are changing, say, a weekly routine, where they're shifting from taking transit once a week to twice a week or 3 times a week, and others who might be switching from no times to 5 days out of the week. I think it's a good question. I don't think they're that disconnected. But maybe they're more disconnected than I realize.
Okay, and one more question. What first interested you in doing this type of research, and what have you found most surprising when doing this project?
I think this has actually been something that I've wanted to look at for over a decade, and I think a lot of it, I just really wanted to look at it because I was frustrated with how people would talk about transit dependence. So I didn't like it. Like it didn't fit my understanding of how people behave. So when I interact with friends and family members who don't have cars, or who are not that they are only going to use transit when it's working well for them, and so it kind of never really fit well with that understanding, and then it also never really fit well with my understanding of choice and how we think about choice. And so I took when I was a PhD student at Berkeley, where that's where Dan McFadden was, and I took choice modeling classes with one of his students, and it just didn't make sense. Like someone who's going to be close to 50-50 is almost never going to be in an area of bad service. So just thinking from a public policy perspective, we're putting so much money into low effort to affect systems, and then also that has, I think, some negative implications in terms of who gets served as well. So it's something I've focused on for quite a while. Things that I was surprised by. One, I think the findings were kind of even clearer than I expected. But then I think my biggest surprise is just in presenting the work and getting feedback from other academics. I'd say roughly half of them kind of respond, "Oh my God, spot on, like this is great." And they're really focused on this theoretical component and thinking about what a choice rider is and how misused and inaccurate the term is. And then I also just get some really negative responses, and it's mostly related to the modeling and people saying, "Yeah, no duh, of course people take transit when it's better. Of course people drive when it's better." But that's really not the point of the paper. And when I talk about the model fit and the parameter estimates, it's really just to try and give you confidence that the model is working well. So that, for me, that's been a little bit of a surprise, that really bifurcated response.
Okay, that is all the questions that we have. Thank you very much, Eric.
I appreciate it. Thank you so much for having me.
All right. Hi, everybody. I just want to say thanks, Eric, for sharing your work. I'm the other transportation fellow. My name's Maggie. And also thanks to everybody for attending today's session. As mentioned earlier, the presentation today will be posted on the Mobility 21 What's Happening page of the website, as well as a video link, because we have been recording it. And you'll also be receiving an email this afternoon asking you to take a short survey about today's SMC. So we really encourage you to take a few minutes and provide your feedback. And then finally, for any students who are interested in further engaging on transportation topics, the Transportation Club at Carnegie Mellon on campus is a great way to tap into events like this and also connect with fellow transportation nerds. And then finally, our next SMC will be on Friday, October 8th. It'll feature Destiny Knock, and she'll be presenting on her project, Transportation Implications from COVID-19, Food Delivery, and Public Transport. So please watch for your invitation in your email closer to that date. So yeah, again, thanks for attending today, and please feel free to reach out with any questions.